The laser procedures, and one of the most common ones that we perform is the fractionated CO2 laser procedure for facial resurfacing. And so CO2 laser is indicated for treating the fine wrinkle lines that occur with aging, also treating sun-related skin damage and sunspots, and even actinic keratoses. That's really what it's indicated for. There usually isn't a whole lot of swelling. There may be a little bit. Most patients don't require any oral pain medication. The skin goes through a period of scabbing over and scaling, and then that layer flaking off, and then that new layer coming in from the bottom. Another type of laser that we use in our clinic is the pulse dye laser. That type of laser works a little bit differently. We're treating small blood vessels that occur in the skin with age, discolorations, pigment changes. That's more for that. The main one that we do is the CO2 laser for skin resurfacing.